First item of business, we're going to do recommendations from the other two hospitals that we met with yesterday, that we met on yesterday. I've got Osh and Larned on my mind. Parsons and and K&I. There we go. Sorry, I'm already on to the next budget. Do I have any recommendations for Parsons or K&I? And I might add that these can be conceptual and we can have them written up. Representative Ballard. I have a motion to approve the governor's recs for K&I. Do I have a second? Second by Representative Helmer. All in favor say aye. Aye. Opposed, same sign. Motion carries. Yeah.
I have a question. I'm down here at this end. I have a question. What are you talking about on the first page here? The governor's recommendation, 124 million? Or what were we approving?
Excuse me. This will be yesterday's budget for Kansas Neurological Institute.
Okay.
So you may not have that in front of you.
Got it. Okay, I understand.
Yeah.
Thank you.
Okay, I think there are some other recommendations on top of that, so we'll go with that at this point in time with further recommendations. So do I have a second for that? No, this will be for 22, yeah. And then Representative Lynn, do you have a recommendation?
Yes, thank you, Mr. Chair. I would like to recommend that we consider adding the agency's enhancement request for increased salaries for Parsons and K&I. Yes.
Okay, committee, I have a committee rec for a salary increase for Parsons and K&I. Do I have a second?
Yes. Mr. Chair, I was making those recommendations and my mic was not on.
Oh, okay.
And I'm not sure that those on Zoom heard it. I was speaking loud enough, but the mic was not on. So I will make the motion again that we go with the governor's recommendation for Kansas Neurological Institute in Topeka. And also that we're going to go with Parsons' governor's recommendation as well, Mr. Chairman.
Megan, are you there?
Yes, I am.
So are we able to make recommendations after taking the governor's recs? Are we able to make recommendations after accepting those governor's recs?
I believe you'll want to make recommendations. You can accept the governor's recommendation with the following changes. So if you wanted to add any changes, you could do that.
That's what I thought. So let's do recommendations before we do that
Yes,
with the following.
that's fine, that's fine.
Okay, Representative Lynn, back to Representative Lynn.
Yes, I'd like to recommend the changes for the agency's enhancement requests for increased salaries for both K&I and Parsons.
I have a recommendation. Do I have a second? Second by Representative Ballard. All in favor, say aye.
Aye.
Opposed, same sign. Motion carries. Further
Sure.
committee recommendations.
Mr. Chair,
Yes,
I wanted to clarify Representative Lynn's motion. Is that for both years or for 1 year?
just 22. And I believe that would be the requested enhancements on page 15.
Thank you.
Very good. Further committee recs. Seeing none, Representative Ballard.
Yes. Then I will make the recommendation that we accept the governor's recommendations for KNEI and Parsons, the governor's rec, with amended, as amended.
I have a motion. Do I have a second? Representative Lynn. All in favor, say aye.
Aye.
Opposed, same sign. Motion carries. Very good. Thank you, committee. Okay, we're going to start today's hearing. We're doing a budget hearing on on Larned and Osawatomie. So, Matt, let's start with Larned. Are you ready?
Hey, Mr. Chair. Mr. Chair, members of the committee, good afternoon. My name is Matthew Moore, fiscal analyst for Kansas Legislative Research Department. Today I'll be presenting the budgets for Larned and Osawatomie. Before you should be my budget analysis. It is going to look similar to yesterday's. This year, as we discussed yesterday, this year we have combined the two hospitals into one budget analysis. I do want to specify, just to make sure that there's some clarity from yesterday. We are trying to we do similar things with the universities and the correctional facilities, where we combine those budgets into one budget analysis. So rather than have multiple, we have the one. And so this year, the decision was an internal KLRD decision to try to combine those two, not all four together, but to still separate out and differentiate between the two sets of hospitals. With that, as I indicated, we do have the budget analysis for the both facilities. Today, I actually will start towards the end on page 31, where it says Larned State Hospital, to provide the analysis just for Larned State Hospital. And as you can see there at about the middle of the page, it begins with the State Hospital in Larned, which provides psychiatric treatment and limited detox facilities to adults within 61 western counties of the state. If you turn to page 32, you will see at the very top a few performance measures for Larned, as well as the budget broken out by categories of expenditures, as well as state general fund and all other funds. I will begin with the agency requesting $75 million, including $65.4 million SGF for operating expenditures. This is an all funds increase of $1.7 million, or 2.3% above what was approved last year. The increase is primarily due to expenditures for staffing at the state hospital. Many of you might remember there the hospitals have historically had issues with staffing. They try to fill vacancies through salary and wages, but at the same time, they do have to have contractual services for staffing to try and meet the needs of the individuals who are residing there. Given the COVID-19 pandemic, there is that kind of further exacerbates any sort of issues the hospitals were facing with individuals now having to be quarantined when they might test positive. So that kind of, in a sense, exacerbates the staffing issues that they were already having kind of further. And so you see an increase primarily related to trying to ensure that they have adequate staffing. I will note that the agency does have a few supplementals, which I will direct you to page 14, specifically for the supplemental request. The agency requested a little over $830,000 for ligature-resistant furniture and a video surveillance system and individuals to monitor those to that system. These are two things. The first, with ligature-resistant furniture, that's furniture that doesn't have corners, doesn't have individual bars that an individual may or may not attempt to commit suicide with. This is a request that has been requested before. As you can see on page 14, the governor's recommendation does not include that request. Then the second is the video surveillance system and officers to observe those systems. Right now, my understanding is the hospital does not have a video surveillance system. This creates issues with trying to monitor to ensure the safety for staff and other patients. And the agency requested to install a system and then have 6 FTEs to monitor that system. I will direct you back to page 33 and 34 to go over the governor's recommendation for FY 2021. The governor recommended $65 million, including $64.2 million SGF. This is an all funds increase of a little over $70,000 above what was requested. As I noted, that the governor did not recommend both of those supplementals for FY 2021. However, there is a slight increase because of the receipt of some COVID-19 related funds. Very similar to yesterday with Parsons and KNI, these are funds that were awarded to the agency after it submitted its budget, primarily for hazard pay and acquiring sanitation and PPE to help maintain the spread of the virus. And with that, unless there are any questions, I can move on to FY 22. Mr. Chair, I think you might be muted.
I'm sorry, I was. Are you done?
Yeah, if you'd like, I can move on to FY 22 if there are no questions.
Questions for 2021? Okay, Representative Helmer and then Vaughn.
Thank you for taking my question. I'm looking at the ligature-resistant furniture, which would cause quite a disruption. The video surveillance system, which would cause a lot more work for employees, and also the salaries and wages, which is kind of a downer for employees. How does that play with having a hard time keeping employees, and if we were to look at doing something there, would that help with, what is your perspective of that? Because I see those as two big safety factors in that type of situation.
Representative, I think he's just going to comment on the facts that we have before us. We'll do some of that decision-making process when we have the agency come in next. So, Representative Vaughn.
Thank you, Mr. Chair. Just a clarifying question. For the video surveillance system, it says that the $766,858 or $766,858 includes the system and the 6 positions to monitor the system, but then the staff note indicates that the 6 full-time equivalent positions do not appear to have been requested. Can you just clarify that, what that means?
Certainly, Mr. Chair, members of the committee, my understanding is that the request did not include the additional FTEs because at the time, the idea was to use unfunded FTEs that the agency might already have to fill those positions. And so there was no request for additional FTEs on top of what they already have.
Follow up if I may. So if the 766,000 is that budget line item, but it does not include this full-time equivalents, is that only going towards the purchase of the surveillance system if the positions are unfunded?
Well, so if it did not include the salary and wages, it would be for the system, but that entire amount is for both the system and the salary and wages. With the FTEs, it is just specifying that you may have an additional 6 full-time equivalent positions. While my understanding is that the agency does have several unfunded ones that are currently just saying that they can have up to this amount of FTE positions. Some of those are unfunded and just have not been removed from their budget. Therefore, the original plan was to utilize some of those FTEs, fund them with the supplemental request, but not increase the number of FTEs that the hospital currently has.
That makes sense. Thank you. Thank you, Mr. Chair.
Any further questions? Okay, continue on with the governor's recs on 2021.
So I will continue on page 34 to begin with the fiscal year 22. The agency had requested $75.8 million, which includes $76.3 million SGF. The governor only recommended $67.3 million, including $57.6 million SGF, and you can see that amount on 35. The difference is primarily related to the some enhancement requests that the agency had requested, as well as the reduced resources that the agency experienced. And to discuss those, I'll turn to page 18. So the agency had requested 5 enhancement requests for 2022. The first being the replacement of what's termed as an Omnicell machine. My understanding is that it's a machine that dispenses medication. It allows for the agency to keep track of who the medication is going to, how often it should be dispersed. It allows for some security to make sure that individuals are not getting medication when they're not supposed to. My understanding is that the machines that are currently at the hospital are out of dated, are not necessarily compatible with current Microsoft support, and so the agency sought to replace those machines. And as you can see on 18, and the governor did recommend that enhancement request. The next request was an additional SPTP unit. That's the Sexual Predator Treatment Program. My understanding is the agency anticipates growth in that program, and so they were looking to fund an additional unit. With that would come the need for staff to staff that unit. I believe the number was 48 FTEs. You can see that on 18, the second bullet. My understanding is that at the time of the request, it was to utilize unfunded FTE positions, which is very similar to how the video surveillance would have worked. The governor did not recommend that enhancement. The next is an SPTP reintegration and conditional request. So the main SPTP unit is located on the state hospital. However, there are integration units in Parsons as well as at Osawatomie for individuals who are nearing closer to the end of the program. Currently, my understanding is that there is one individual who is charged with kind of keeping tabs on those individuals when they might have maybe a community outing. And then once those individuals leave the program, are successful and are out, they do have kind of they're observed by the staff member. And my understanding is there's currently one individual at Larned to cover the entire state. So the agency was seeking to expand that to have an additional 2 individuals, one that would cover the western portion of the state, one that would cover the eastern portion of the state, and then an additional one to help with kind of monitoring individuals on at the Osawatomie and Parsons for conditional release. The governor did not recommend that request either. The last is a safety and security upgrades. That is to continue the salaries from the supplemental request for the video surveillance system into this year, rather than continue it. What the governor was recommending is that they install and have the positions in FY22. So what they requested in FY21, the governor denied. However, she is recommending that same request in FY22. And my understanding is that it will include an additional 6 FTE positions to staff that. I believe that the number is 0, but if you look at the very bottom of the total, there's the addition of that 6 FTEs. That's a mistake on my part, I apologize, but that the governor's recommendation is rather than use unfunded FTEs is to increase the FTE count for the hospital to account for those new positions to monitor the video surveillance system. The last enhancement request is a transfer of funds to KDOC. My understanding is this is related to the elimination of a transfer from Larned to the Department of Corrections for the care of inmates with mental health needs. My understanding is in the last several years, there were some individuals that were transferred to Larned from the correctional facilities who were experiencing mental health issues, were being cared at Larned. And so Larned was given the money to care for those individuals. Since then, those individuals have shifted back to the Department of Corrections. And so Larned was still receiving that appropriation. However, they were transferring it to the Department of Corrections to care for those individuals. And this year, both the state hospital and the correctional facility had kind of similar requests to just move that appropriation from Larned to the correctional facility where those individuals are ultimately being cared for. And that the governor did recommend. So that money would be shifted from Larned State Hospital to the correctional facilities for the care of those inmates. Then moving on to page 20 is where the reduced resources occur. Due to it being combined, this does include some of Osawatomie's reduced resources. But if you look at the table, the first reduced resources related to Larned State Hospital is that LSH food service for LCMHF. And what that is, and you can see the narrative on page 21 at the very bottom, that last bullet, is the elimination of a food services contract between the state hospital and the correctional facility there in Larned. My understanding is because they kind of sit on the same campus, there traditionally were some kind of sharing of resources. Some of the inmates would come over to the state hospital, provide assistance in the kitchens, assistance in the laundry facilities. However, in recent years, there has been less of a utilization of that inmate services. They've shifted back to the correctional facility. And so the agreement was to provide food for those inmates. And since they're no longer providing the services at the state hospital, the first reduced resource package was to end that contract between the state hospital and correctional facility, which the governor adopted. And my understanding is that those costs would shift to the correctional facility. So rather than Larned paying for feeding these inmates, the correctional facility would then have to feed those individuals. The next is on page 22, the closure of one district court SSP unit. What that is the Larned is comprised of this kind of 3 units: the psychiatric, the state security hospital, and sexual predator treatment program. And then the first reduction was to close down one 30-bed male unit on the state security hospital. My understanding is that it was currently closed due to COVID to help provide some isolation for patients. However, due to the reduced resource package, they submitted just making that change permanent. So where it's now temporarily closed for isolation units related to COVID, it would then be permanently closed moving forward. And the governor did adopt that. The next would be the reduction in the psychiatric capacity. Currently, they have room for 90 beds, but that was moved down temporarily for 72 beds, again, to account for isolation for COVID. My understanding is that would continue going forward and then reduce the capacity down to 72, very similar to the closure of the unit above, taking a temporary change related to COVID and making it permanent. And the governor did adopt that request or proposal. The final one is the reduction in contractual service spending. So my understanding is these are contractual services for doctors, nurses, therapists to provide services on the campus. And the governor did recommend reducing the SGF for that. However, if you look on page 20 on the table, she did recommend that rather than utilize SGF for the agency to utilize fee funds and other special revenue monies. So if you look at the very last item on the table is that reduced contractual services, there's a decrease in SGF, but the all funds is 0. That's because the governor's recommendation is saying, go ahead, we'll reduce the SGF, but utilize fee funds to kind of offset that decrease. I don't.
Continue.
And I'd like to highlight on page 24, just the fee fund for Lawrence State Hospital. Again, it's very similar to Parsons and K&I that we discussed yesterday. The description is there at the bottom of page 24, and the table is on page 25. This is a fund for, it's kind of related to the recoupment of insurance payments for when the hospital can. It's not a traditional, what you might think of as a fee fund, as the agency charging fees. It is more of a recoupment of monies. If a patient might have private insurance, and then they might be able to have a little bit of money from the private insurance paying, that goes into the fee fund for the state hospital to utilize. And you can see on the table and chart on page 25, the revenues, the expenditures, and the ending balances there. Unless there are any questions, I can briefly touch upon the capital improvements for Larned State Hospital.
I think let's just move on to 2022. Hang on just a minute. Representative Howard has a question.
Thank you, Mr. Chair. On page 18, the replacement of the Omnicell machines, you got two expenditures, one from SGF and I don't remember what the other one is from, but it's two payments of $283,000. But then in another statement, you talk about that both Microsoft and Omnicell may have a problem with the software. It's on. Oh, I'm not close enough?
Matt, we're going back to page 18, looking at the Omnicell machine replacements. And Representative Howard is seeing $283,492 in SGF and also all funds. So I think his question is it being paid for by all funds or
And the other
SGF?
question, and the other question is, have they got the software issue resolved? Because they could potentially be buying some equipment that won't work for them.
We'll be sure and ask the agency that.
Thank you, Mr. Chair.
Could you clarify that for us, Matt?
Certainly. So with respect to your first question, the all funds is reflective of all funds that the agency is utilizing. So with that, the reason it says 280, a little over 280,000 in both columns is because they are utilizing SGF, which is included in the all funds number. So it is utilizing SGF, but because it is all funds, just the entire expenditures for the agency, SGF is included as all funds, so it appears in both. So, for example, if you would look down to safety and security upgrades, you'll see SGF 3,336 and some change, and then on all funds 767. The SGF is what's being spent in SGF monies. That is included in the all funds, but the reason that is higher is because there is additional funds, I believe, from the State Institutions Building Fund contributing to that request or that recommendation. So it includes both the SGF as well as the other funds that the agency is utilizing.
Good question, Representative.
And then
further questions. Representative Helmer has a question for you.
Thank you. On 24, am I to believe that hospital fee funds are Medicare, Medicaid, whatever funds that come in? Is that
Certainly.
correct?
Yes, so
Okay.
again, those are, I was going to say,
sorry.
those are part of those recoupments that the agency receives. Those Medicare payments are part of that, very similar to with if they had private insurance. Those are additional funds that the agency is recouping for the care and putting it into the fee funds.
Okay, this is just a statement. I just think that 7.2 and 7.2% is just, sounds so low for that population. If maybe someone is just not filing for them or taking care of paperwork. That's my statement. Thank you. Thank you, Mr. Chairman.
Committee, further questions? Representative Ballard.
Not that, I'm sorry, Representative Helmer, I didn't quite understand what your concern was on that one that he responded to. I wasn't clear.
To get into Medicare and to follow up, you know, you have to do paperwork, you have to be there, you have to file. And so 7.2% for that population, it just seems extremely low for an ongoing population. And it just seems like maybe some follow-up should be done with that. And that would maybe save on the state general fund and move some funds around somewhere else, is my concern. Thank you.
Matt, do you want to explain? That's more of a funding source than it is. It's just saying that they receive 85% of their money from the state general fund. They receive another 7.2% from hospitals and 6.9% from Medicaid or DISH. They may receive disproportionate, I never can, hospital share or whatever. And the other funds is 1/10%. Oh, you're down at the,
That's why I said question, because that's not the total percentage of the funding. But I understand, that's why I was asking that, because they come from various sources.
Just thought maybe it was a good place to check, and maybe we could get out of that general fund, because it's talking about insurance reimbursements for eligible patients, and we know that maybe some paperwork isn't done somewhere, so it just seems like a real low number for 7.2%.
let's ask the agency that one. Matt, continue on.
Certainly, Mr. Chair. So that would conclude my remarks for FY22. I can briefly touch upon the capital improvements for Larned. If you go to the very last page of the analysis, page 36, I'll note that if you look at the chart, there are 3 items in capital improvements. The very last one is the Isaac Ray security doors. That is included in the agency estimate, as well as the governor's recommendation. My understanding is that was approved last year to upgrade the security doors on the Isaac Ray. That's part of the security hospital. That was approved, and it's just included in the request and the governor's recommendation. I will make note that that neither KDADS nor the state hospitals have gone before Joint Building Committee yet, so there's not a recommendation from Joint Building Committee. I think that they don't go before that until, I believe, the 15th.
And that was the money they were going to fund what were they going to fund out of the state building?
Well, so that is just in terms of the capital improvements. So that's upgrade of the facilities in terms of, capital improvements are generally fixing machinery on campuses, upgrade, remodeling, things like that. For the security system earlier, it is suggested to use state institutions building fund, but that's not considered a capital improvement. Here on this last page, because it is fixing the doors on the hospital, so an actual physical change to the hospital, it is considered a capital improvement. And my understanding is that was approved last year, and is included in the budget for this year because that's what was approved for last year.
So while you're on that subject, you mentioned state building fund. Will you explain to the committee what that is?
So the State Institutions Building Fund it's the fund that's what funds capital improvements. The Joint Building Committee hears when there's a state-owned building, they hear the budgets for any suggestions on how to any improvements for those buildings. Like I said, fixing machinery, re-roofing, doing upgrading facilities. They hear those and then make a recommendation to approve or deny those sorts of requests. And then sometimes they can be utilized with the state general fund, but then there is a separate fund labeled the State Institutions Building Fund, which is directed to be utilized to improve to provide improvements on state-owned buildings, which the hospitals are state-owned buildings.
How is that funded?
I would have to double check for you. I can certainly get that readily available, right?
That's all right. You can get back to us in a minute.
Certainly.
Okay, very good. So does that complete your presentation on the budget for Larned State Hospital?
That's for Larned.
Okay. Committee, just to try to, maybe one of the things that I look through here is, and I'm just trying to, I look at the end deal right here, the last paragraph on 35, and that really kind of explains what this budget is. The government recommends $67.3 million, including 57.6 from the SGF. And then there's decreases in there, 8.4 million. And that's just kind of says everything that we just went through. So just for your own, it explains the enhancement requests, the Amistel, all that kind of stuff. So just for your information, that all that information that we went through, which is all written out here, is also in that last paragraph. Okay, very good. Any further questions on Larned? Okay, continue on to Osawatomie.
He's talking away too.
We can't hear you.
I apologize. Somehow I was muted. So I will direct you to page 27 with Osawatomie State Hospital. Osawatomie State Hospital is the mental health institution for the eastern half of the state. So where Larned is for the western half, Osawatomie is for the eastern half. You can see at the bottom of page 27 is the kind of some performance measures for Osawatomie. But then on page 28, you'll see the very similar chart breaking up the expenditures by salary and wages, contractual services, and so forth. The agency requested a revised estimate of $47.2 million, including $38.3 million SGF for operations at Osawatomie State Hospital. This was an increase of a little over $200,000 or 0.5%. Primarily due to staffing fluctuations preparing to lift the moratorium on Osawatomie. Members of the committee may remember the state hospital does have a moratorium on voluntary admissions, kind of stemming from the decertification of beds, I believe back in FY 2015, where all of a sudden several beds were no longer eligible for Medicaid funding. The hospital has been working to address some of the concerns in order to recertify those beds and receive federal reimbursement for those beds. Currently, there are 60 beds that are certified to receive Medicaid reimbursement for the care of those individuals. That is part of what's termed as the ADARE acute care unit on osawatomie. And there is a plan that was, I think, brought forth last year before this committee to further help address the moratorium and eventually lift it from osawatomie and allow voluntary admissions. And part of that is due to it remodeling to allow for recertification. And so as part of that, there's trying to maintain that staffing for the state hospital to ensure that they have adequate staff. Again, similar to Larned, they do have issues maintaining the staff. My understanding is competition with surrounding private organizations, and so they face competition and have issues, maintaining staff. Very similar to how you might, what Parsons and K&I might have said with some of their staffing issues. As a result, they also use contractual staff, and they intend to utilize both FTEs and contractual staff to maintain that they have adequate staffing for the hospital, which is exacerbated partly again by COVID, when they're already facing staffing issues. All of a sudden now you have individuals that might be quarantining. It might put a little bit, kind of raise those problems that were already there and kind of exacerbate them a little bit more. So there's a slight increase to try and maintain those staffing levels to provide care for the residents of the state hospital. On page 30, we'll note that the governor recommends $47.9 million, including $37.9 SGF. It's an all funds increase of a little over $360,000, primarily due to the receipt of COVID money. Again, as with all the state hospitals, after the budget was submitted, they received federal CARES money to provide hazard pay, purchase PPEs and sanitation device supplies to help stop the spread. So that money appears as an increase in the GovRec simply because it was awarded after the agency submitted its budget. Other than that, there's no real decrease. The agency didn't ask for any supplementals for FY21, so it was the only increase is attributable to the receipt of that federal money.
I have a question. In the narrative, I didn't see anything about the $5 million from the state building fund that we had used at OSH and authorized last year for remodeling there for the ADARE deal. Do you have any idea where that would be? Or because
Certainly.
it's the building fund, is it someplace else?
Certainly, Mr. Chair, and I apologize. I may have missed that portion on my capital improvements discussion. So part of the, with all of the state hospitals, osawatomie does have a few capital improvements. However, most of the capital improvements appear in KDAD's budget. They submit their requests to KDAD's, and then the capital improvements show up in KDAD's budget. So that particular item for the remodel appears in KDAD's budget because it's a capital improvement for the state hospital. And all of those generally show up in KDAD's budget.
Very good. I think I asked that same question last year. So anyway, thank you. Continue on.
And unless there are any other questions on 21, I can move on to 22.
Committee questions on Osawatomie State Hospital for 2021. Continue on to 2022.
So continuing on page 30, the agency requested 47.3 million, including 38.2 million SGF. This is an increase of a little over $36,000, or 0.1%. The agency anticipates similar levels of spending from FY 21 into 22. The fluctuations are just based off of different kind of the actual utilizations for 22. They anticipate just little higher increases here and there, but nothing major. And then I will note on 31, in the middle is the governor's recommendation of 46.6 million, including 34.4 million SGF. This is an all funds decrease of $336,000 or 1.4%, all due to the reduced resources, which I will turn back to page 20 to begin my discussion. So the agency submitted 7 reduced resource items. You can see that on the table. Those are the first 7 items, beginning with elimination of physician longevity bonuses. My understanding is for that first item, those are providing bonuses to physicians who have been at the facility for quite some time. They provide those bonuses kind of as a means to retain those employees. That was one item that they kind of pointed to as being a place where they might be able to reduce. The second would be to shift the Adair acute care nurse managers from an exempt status. My understanding is that there was a difference because of the federal the certified beds being on one unit, the Adair acute care unit, and then the rest of the state hospital, there was kind of a discrepancy between the status of some of those positions, and some were non-exempt and some were exempt. And so the agency pointed to shifting those acute care nurses from exempt status back to non-exempt status, which would reduce the SGF by $135,000. The next item is an increase in the shrinkage rate for Osawatomie. So they had traditionally maintained a shrinkage rate of between 20 and 25%. So my understanding of shrinkage is that, when you have individuals, so the agency budgets for salary and wages for certain, how much it anticipates to pay those certain individuals. Now, when you have positions leave, vacant positions that that show up in the actuals, perhaps they had some people that they were looking to hire, they were anticipating to pay that, pay that individual. That position they did not find any applicants for that position. Well, they originally budgeted for that position, didn't end up having to utilize that full amount. And so it kind of creates a discrepancy. And to help kind of account for that, they utilize what's called a shrinkage rate to say, this is how much we think our salary and wages might shift based off of things like we have vacant positions we're looking to fill. We may not fill those for the entire year. It may only be, half of the year. We still have to budget for the full year in case we do, but there might be a gap between when that person might actually be hired. Another instance would be if we have an individual that retires, is at a higher salary rate. Well, if you hire someone that doesn't have as much experience, you may be hiring them at a lower salary rate. So there's a discrepancy between how much you were paying that individual and may have budgeted for versus how much you ultimately spend on that new hire. So in order to help kind of account for that and to ensure that salary and wages is, can be as accurately reflected as possible, we utilize shrinkage rates to say, traditionally, this is how much our salary and wages might fluctuate. Generally, it maintains about 20 to 25%. It's currently at about 18.2. And so what the agency kind of recommended was we could maintain it at a higher rate. And this would kind of represent holding approximately 16.2 FTEs open. So not hiring vacant positions in order to maintain a kind of a higher shrinkage rate. And that would result in levels of SGF savings. The next one would be a very similar concept for the SPTP unit. As I mentioned in Larned's budget, there is a reintegration unit on Osawatomie. So individuals who are part of the sexual predator treatment program, kind of on the later stages of the program, they do have a unit on Osawatomie for the care of those individuals. It would be, again, raising that shrinkage rate to kind of allow for some savings. The next is a reduction in the SGF appropriations for the the Adair acute care unit, just reducing that straight by $1 million. And then reduced commodities and capital outlay expenditures. So reduced expenditures for kind of one-time purchase, items such as, pencils, pens, those sorts of, use it and then we're kind of done. And then capital outlay expenditures are those sort of, longer, term items, computers, furniture. So just kind of reducing spending in those categories for FY22. The governor recommended all of the reductions in SGF. However, if you look on page 20, there are a few spots where she suggested to utilize fee funds or special revenue funds to offset that decrease. And those are going to be with those salary related items. So the longevity bonuses, the nurse manager's exempt status change, the shrinkage, those sorts of items she suggested utilize. I want to reduce your SGF, but how about you use fee funds to offset that reduction? So it kind of creates a zero effect for fiscal year 22. Additionally, she did accept the reduction for the SGF for the Adair acute care unit. However, she did recommend to utilize fee funds to offset that increase, which is why you see an all funds zero balance there. I would stand for questions for FY22.
Questions on FY22 for Osawatomie State Hospital? Representative Vaughn.
Thank you, Mr. Chair. I just had a clarification about the shifting of Adair acute care nurse managers to exempt status. It's kind of the opposite mentality that K&I presented yesterday when they shifted their employee status from exempt to non-exempt. And so I was just curious if you could kind of explain in greater detail the nature of the complaint that was filed.
Mr. Chair, members of the committee, with respect to that particular item, I mean, I can identify what the item was in terms of what maybe prompted the need to change that. I really have to defer to the agency on that, as they would be more able to present what that cause was.
Save that for the agency.
All right, thank you. Thanks, Mr. Chair.
Any further questions on OSHA's 22 budget? Okay, very good. Thank you, Matt. You're off the hook. We're going to go now start with, on WebEx, we have Lisa Dipman, Lawrence State Hospital Superintendent.
Mr. Chairman, it's Scott Brenner with ks. Again, if I could have access to share my screen, I can work the slides for Superintendent Dipman and Superintendent Feedback. And I did want to just answer one question from yesterday, if that's okay, in follow up.
Yeah, that'd be glad. Be great.
So you asked a question yesterday about if there were any overall salary increases, cost of living increases at any of the state hospitals, and there were not in the approved budget. I think the note that was in the KLRD write-up was talked about the prior fiscal year. So just wanted to make sure I answered that question. And I'm not going to take any time to go through the first initial slides in the deck that are specific to Larned and Osawatomie, but you'll have in there the patient counts, vacancy, turnover rates. You can look back at that at your reference, but I did want to just make that one clarification from yesterday, and then let Superintendent Dipman take over from there. And I'm available for questions as we go through the presentations as well.
Very good. Thank you.
Lisa, you're muted.
I apologize. Can you hear me now?
Yep, we can.
Okay. Thank you, Representative Carpenter and committee members. As mentioned, I'm presenting on Larned State Hospital today. And as Matt mentioned earlier in his presentation, Larned State Hospital does have 3 distinctly different programs. We have the Psychiatric Services Program, we also have the State Security Program, and the Sexual Predator Treatment Program. The Psychiatric Services Program admits individuals who are civilly committed. Those are individuals that are screened by the Community Mental Health Center in central and western Kansas, or they're referred under an order of evaluation or treatment from a judge. In 2020, the Psychiatric Services Program admitted 837 patients and discharged 842. As mentioned, during the COVID-19 pandemic, we did have a need to reduce the census from 90 to 72 to allow for single room occupancy with our patients in that program. In 2020, we did have a wait list for patients. There were 56 days of the 366 days of the year that we had a wait list. There, if you look at the entire year, there's approximately 13 pending admissions per month. Again, that's across the entire year, and I have some graphs that I'll show in just a moment with those numbers. I'll go ahead and move to the next slide, Scott, and go ahead and look at the graphs. On this slide, it shows the number of patients on the wait list, per month, so you can see how many patients in each of the months we did have on the wait list. The next slide, it shows the number of days that during the month that we had a wait list. And if you look at just the months that there were actually waits, there were a total of 56 total days in 2020 that there was a wait list on the Psychiatric Services Program. Then on the next slide, this graph shows the average hours that individuals waited for a bed. And so you can see, like for example, in May there were 32, December there were 32. So if someone was on the wait list, that's the number of hours that they waited. Okay, the second program is the State Security Program. This program serves the entire state of Kansas. They admit males and females through the district court system. They come through for various reasons. It could be for criminal evaluation, competency restoration, treatment of confinement, not guilty due to lack of mental state. And we also do have a small number of transfers from the Department of Corrections. These individuals that come to this program, they are charged with felony crimes and they can be very dangerous. The program also houses the Security Behavior Unit that serves Osawatomie State Hospital, as well as the Psychiatric Services Program. Those are individuals that are extremely aggressive that transfer there through an administrative transfer. Once they're stabilized for that aggression, then they do transfer back to Osawatomie or to PSP. Excuse me. Okay, this next slide, this is the wait list for the state security program. As you can see, it shows the number of defendants that are on the wait list in the blue line. And it also shows the average number of days that we have offenders that are waiting per month. The third program at Larned is the Sexual Predator Treatment Program. This program was established in 1994. It is for the civil commitment of persons identified by law as sexually violent predators. The SPTP program has a dual mission. The mission is to provide for the safety of Kansas citizens by establishing a secure environment in which persons who are identified as sexually violent predators can reside. The second mission is to offer treatment with the aim of reducing risk of reoffending, allowing motivated individuals to complete the program and then to return to society. Excuse me. LSH does provide clinical oversight for the entire state of Kansas for SPTP. There are currently 245 residents on our Larned campus that are in the inpatient program. Additionally, there are 24 residents that are housed in 3 different reintegration facilities. And you can see on the slide that there are 9 at Myre East, 7 at Maple or Willow at Parsons, and then 8 at Michael House or Vittle at Osawatomie. And then additionally, there are 16 individuals that are in the community on conditional release. So the SPTP, the full census, if you add all those numbers together, is 285. The agency does estimate that that number will continue to increase as more offenders are committed to the program. And as the court order more individuals into SPTP, there will be a need to either increase capacity at Larned or to develop other options to continue to admit those individuals. Also, as individuals advance through the program, there will be a need to increase capacity at the reintegration facilities. Under the current law, it is recognized that there's a maximum of 16 individuals per county that can be housed there. As noted by Matt, LSH did request additional funding in the budget process for staff and also capacity at Larned. The next slide, it does show the inpatient census. As you can see there in 2020, 245. The next slide, it shows the excuse me, the number of residents in reintegration facilities and also the number of individuals that are on conditional release. This past year, we focused on trying to build a healthier hospital. Some of those initiatives that we had was agency-wide recruiting for new employees, agency-wide retention of our current employees, and modernizing the forensic evaluation process, and that is in order to reduce that wait list in the state security program. Also collaboration with the community and building those partnerships. And then continually we work to enhance the safety and for employees and also for the staff. So as far as the recruiting, we continue to work hard to recruit new employees. We have been actively promoting the ks.gov and the Be the One brand, and we put that on all of our recruiting materials so that that brand is out there. We also focus on the positive aspects of the hospital through our Facebook page, and we try to highlight the positive endeavors, accomplishments, events that are going on. We have attended virtual job fairs. Of course, with COVID, that did limit those job fairs to virtual ones only. So we did have some limitation there, but we did participate in the ones that we could virtually. We continue to contract with KU Recruitment and Retention Center to assist in recruitment of medical staff. We entered a large advertising campaign this year with KSN. We found that to be very helpful with our recruiting. We run commercials on KSN. We've focused, KSN is focused on our Facebook through initiatives there, digital marketing, and also the Kansas Best presentation. We did one of those. We continue to recruit on social media. We've advertised on Facebook and also on Indeed. We have worked with the Kansas Work web-based job matching and the virtual and attended those virtual job fairs. We, excuse me, have, in January, we proudly graduated our first class of MHT technicians. This was a class that was actually an outreach from Osawatomie. If you recall last year, it was mentioned that that was one of the things that we were working on, and we did graduate that class, so we're very proud of that. We also have been utilizing agency RN, LPNs, and CNA staff to supplement the unit coverage. We wanted to get that work-life balance for our staff. We currently have 21 RNs, 15 LPNs, and 17 CNAs that are from the agency. We, excuse me, we've employed over 30 temporary employees. Those are what we call our float pool employees. Those are individuals also that work on the unit to supplement that FTE count. So when we have vacancies, we do have these that help supplement that coverage on the units. We have also worked on hiring other temporary staff that are individuals that perhaps have jobs or they're in school, but they're willing to come back and maybe work over the holidays or something like that. So we do employ 2 float pools. We have an A and a B to accommodate anyone basically that's willing to come work and put in the excuse me, put in the effort. We do offer a campus housing for employees. We have some nurses that travel from a far distance, and so we do have that campus housing that we can offer. That also is recruiting. And then we also serve as a practicum site for bachelor's and master's level programs for social work and psychology students. We currently have, we just started with 5 social practicum students that started here in January. And we're also an American Psychological Association approved site providing internship and postdoctoral training for psychologists. We also focus on retention of our current employees. We've displayed the Heroes Work Here banner. We still have that displayed on our campus to offer employees, you know, that they can see it when they come to work, just to know that we do care about them, and that we do realize that, especially through the pandemic, they've done a lot to step up. We also offer tokens of appreciation. We did that especially during the early months of the pandemic when morale was getting really low with our staff. We've advertised in a local magazine called the Pawnee County Source to promote our employees. We've used pictures of our employees with the water tower and that Be the One logo. We've also used our own employees in the KSN commercials so that they can also get their face out, you know, say, hey, Mom, look, I'm on TV. So we felt like that was also helped in the retention of our staff. We have a special thanks and recognition committee that focuses on appreciation efforts for our employees. We try to do something every month for employees. We also have a recognition program called the Shooting Star, where anybody can submit a shooting star to an employee, and then all of those names that get submitted, then those go into a drawing and we draw out a reward for employees. And we do that each quarter. We celebrated Hospital Week. Each year we do that in May, and then we offer an incentive to our employees, just a token of appreciation. And last year, due to the pandemic, we did hold our Employee of the Quarter and Employee of the Year presentations via virtual presentations. We also had our Years of Service Awards, and we did have staff that were recognized for 10, 20, 30, and also 40 years. And again, that was through virtual presentations because of the pandemic. Excuse me, we held our annual mental health conference. This year we had to do it through Zoom, but we continued to hold that in spite of the pandemic because we know our clinicians, they do need to get those CEUs. So we wanted to make sure that they had that opportunity. We also held our annual mental illness awareness event. Again, we did everything virtually. We had Facebook Live where we had the mayor and myself, where the mayor signed the proclamation for the event. We had have our endowment committee, and they provided 2 $500 educational scholarships for employees. And then we do have a Caring Hands daycare here on our campus. It serves not only the campus, but also individuals in the community, but that's a place that our employees can use for daycare for children. And I will mention that the daycare, they did a good job of staying open through the pandemic to provide that service for our staff. So that was very much appreciated. Also, we have the Route 264 Sunflower Grill. That grill is a place where employees can order food for either breakfast or lunch. Of course, due to the pandemic, we currently just have carry out or delivery service for that. And then our employees also, as mentioned earlier, they did receive pandemic cash awards. There were 3 of them in calendar year 2020. Another initiative we have is modernizing the forensic evaluation process. We've talked about this last year. State Security Program continues to review every referral from the district courts and consider cases for possible completion of mobile competency. We do have our legal liaison that reaches out to the courts. If we don't have an order for mobile competency, she will reach out to the court and offer that as an option for them. And also we have a template that she provides as far as a template for an order for that. And our hope is that that will continue to work with the wait list on the SSP program, because we do recognize that wait list. We also provide a monthly report to the Sheriff's Association. We want to keep them informed about the wait list. We do know that there is an impact on the Sheriff's Association, the members there, with individuals waiting in jails. So we want to be open and transparent with that and provide that information to them. This past year in 2020, we did partner with 21 counties where mobile evaluations were provided. We also continue to build on our community partnerships. We remain a member of the Pawnee County Community Health Organization, where we can meet with local medical providers to share information between agencies. Also, this past year, we had the local emergency planning committee that was developed. This was initiated because of the pandemic. It gave opportunity for individuals here at the hospital to reach out to individuals in the community and back and forth. It gave us direct access to our community members, the health department, that sort of thing. We also host a citizens advisory committee each quarter, and that's where local leaders, they meet with us at the hospital. Of course, we've been doing it by teams this year because we don't, the COVID and everything, but we do want to share information with the community and also get information back from the community to get feedback. We do hold a seat on the board of the daycare that's here on our campus. We also participated in a project called Mask Up here in Pawnee County, trying to encourage individuals to wear masks out in the community. And so we're part of that as well. Also, prior to receiving our vaccine here at the campus, one thing directly related with the COVID is we have the Heart of Kansas Clinic here in Larned and also the Pawnee Valley Hospital. They reached out to us. They had additional vaccine that was earmarked for healthcare workers. They were able to provide us 126 vaccinations for COVID, and that was much appreciated. Our nursing department did go into town. Those were provided in town. Our nursing department did go into town and help provide those vaccinations as far as actual giving the shots. We do partner with United Way of Central Kansas. We reached out to school system in Pawnee County. We offered a poster contest as part of our Mental Illness Awareness Week, where we wanted to provide education at the middle schools in the county and the high schools to help understand and reduce that stigma of mental illness, and also to see through their eyes through the poster contest. We're a member of the Larned Area Chamber of Commerce. In 2020, we were nominated for Large Business of the Year, and we continue to hold those quarterly meetings with the community mental health centers that serve us in this area. Sorry about that. We continue to strive for employee and patient safety. One of the things that we've been working on this year is getting a single point of entry on our ATC building. ATC building is our building that serves the PSP program. Previously, we had, you could enter through a dozen doors. And so we want that single point of entry just for added safety. And so we've also implemented training changes to processes related to contraband reduction, room and pat down searches, chemical access, transports, and we've also increased some signage in different areas, again, focusing on that safety. We also established a general medical clinic on the Dillon building. Prior to this, the clinics were only available on the Isaac Gray building, and so that meant transporting SBT per residents from Dillon building over to Isaac Gray building. And so this does help with that transport. Also, it just offers medical staff the quicker opportunity to see those individuals right there on the building where they're at. Our chief medical officer also developed and implemented training for medical and nursing staff on delirium versus dementia. We realized that was a need as far as getting that training out. And so that was developed and is still in the process of being conducted. Also talking about the safety aspects, Matt did talk about the video surveillance. We do need that video surveillance on the ATC building, which serves our psychiatric services program. We need that for managing safety and security in public spaces and enabling that 24-hour monitoring of our patients. We see that could increase the response time if there are incidents happening and the security officers would view something occurring. They could call for assistance a lot quicker. It would also potentially reduce violence and aggressive behavior. The Omnicell machines, we do need those replaced. Those are medication dispensing machines. Right now, the software on those, it is not being supported any longer. The new machines would have new software that would be supported. We dispense 10,000 doses of medication every day to over 400 patients and residents on our campus. And so right now, neither Microsoft nor Omnicell are going to be providing software support for the current Omnicell machines. And so that's why we really need those. And also, we don't want medication errors to increase. We don't want HIPAA violations. We are concerned with insecure data if we don't have the new machines and the negative impact that that could cause on our patients and residents. Okay, shifting now over to COVID-19. This slide, it does show you our COVID-19 numbers as of the 1st of February. You can see that for tested conducted for staff, it was 1,436. Our current active staff cases is 6. We have 161 individuals that are have recovered. We did have one employee that passed away as a result of complications from COVID. On here, I do track our Sodexo food service contract numbers a little bit separately, just so we can break those out. We currently have 0 active cases, and we have at a total of 9 employees in Sodexo. So on our entire campus, there was 177 cases total. And then the next section there, it talks about residents and patients. As you can see, tests conducted was 870. We currently, well, as of the 1st of February, had 3 active cases, 202 recovered cases. We did have the death of 1 individual related to complications of COVID. And then total cases for our patient and resident population as of the 1st was 206. The next slide talks about things that we did to sustain through the pandemic or during the pandemic. We did develop very early on a core pandemic team, and also we have a pandemic leadership team. The core team meets multiple times a week. The larger group meets weekly, and that's to share information, make decisions, troubleshoot things that are going on with the pandemic. We also executed a comprehensive pandemic preparedness plan. We implemented quarantining individuals that are admitted, whether it's on SSP, SPTP, or PSP, quarantining those individuals as per the KDHE and CDC guidelines. We also, as noted before, we did have to reduce the census on PSP because we did not want 2 individuals in a room together with the spread of the virus. And so we reduced from the 90 beds to the 72 that has continued currently. And then on SSP, we did close 1 unit because one of the complications that we saw is we have 3 different populations that are so distinctly different by statute, we cannot mix them. So PSP patients, if we had a positive individual, we need to remove them from that unit, but we can't put them on a unit where maybe have a positive SBTP individual or SSP individual. So we had to come up with 3 different areas where we could put patients in isolation who were positive for COVID. And so that's the reason that we do have those, that reduction. We also had to close that unit to come up with space for that. We developed and implemented a screening for employees and our patients and residents. We also initiated wearing facial coverings back in March of 2020. We continue to do that, and we do have surveillance going out and checking, making sure staff are wearing masks, and trying to continue that education. We also, this is very, I don't know, I thought it was very good. It came from a request from a resident. We had a resident who actually offered, you know, is there something we can do? And so we did employ some of the SBTP workers through our vocational program, and they created over 3,500 masks for our staff, our residents, and for the patients. This was a time when you couldn't find a mask and everyone's trying to make masks, and it was very thoughtful, and we greatly appreciated it. Other things we did, we implemented and continued to require COVID-19 protocols of social distancing, hand hygiene, facial coverings. We increased disinfecting. We still have in place where disinfecting of high-touch areas is to occur every 4 hours. And then that surveillance monitoring I mentioned, of looking and making sure that employees are doing what they're supposed to do. We implemented visitation through Skype because we do recognize that patients and residents do continue to have the right to see their family. And so we've utilized the Skype platform. We also utilized telemed with our outside medical providers when the pandemic was, when there were really high cases and we couldn't get 2 providers. We worked with them to do that telemed. Our first positive case for an employee was on the 21st of April last year, and our first case for a resident was on the 30th of October. We do feel like that's something we're proud of, is that we were able to put measures in place and to hold that off until October, or the end of October. So we felt like that's something that we're pretty proud of. Collaboration with the Pawnee County did result in those vaccinations I mentioned earlier. We also had some staff that on their own went to Pawnee Valley for vaccination, and so a total of 137 of our employees were vaccinated through the Heart of Kansas or Pawnee Valley Hospital. And then we did receive 100 doses of vaccine from KDHE on the 13th of January. We used those vaccinations initially for employees. We offered employee vaccine clinics. We did have 66 of our employees that were vaccinated. And then we didn't have any other employees that requested vaccination or wanted vaccinated at that time. And so then we took the remaining doses and we vaccinated 33 of our patients. If you add those numbers up, you say 66 and 33, that's only 99. We did, during one of our employee vaccine clinics, we had some individuals that didn't show up. We tried to call people that said, yeah, maybe I want a vaccine. We tried to get those spots filled, but we had one dose left and we don't want to waste a dose. So we did take that dose to the Heart of Kansas, and they were able to give that to someone in town. We had requested an additional 200 doses of vaccine. We currently have 211 of our patients and residents that indicated they do want to be vaccinated, and we were notified just this week that 200 doses of vaccine will be coming next week. So we are gearing up then to vaccinate all of those patients and residents that wanted a vaccine, and also to open up additional clinics if there's any other staff that do want to be vaccinated. Looking at the enhancement requests, the Omnicell replacement, that's already been mentioned. I think Matt went over the numbers there, but that is on our enhancement request. And so that's something the governor did recommend and that we requested. And also the upgrade to that security system for the camera, and also for the 6 officers to monitor that. And I will note that is on our ATC building. We do have some camera systems on some of our other buildings, but we do not have on our ATC building. We only have on one unit, and the system is very old and it doesn't function very well. It's locked in a cabinet and you have to do a lot of special things to even get in there and view any video. So we think that this will be a safety measure that would help on that program. And I do want to note that that is the only program we have that is the Joint Commission as well as CMS accredited and certified. The reduction packages, I think you're already aware of those. I don't know that I need to go over those again. And so with that, I will stand for questions.
Questions? Representative Ballard.
Thank you, Mr. Chairman. You were talking about reducing, I think you said the units from 90 to 72 and making them single beds. Did I understand you correctly?
Yes, ma'am. There are some of the rooms that have 2 beds in them, and if we reduce it down to the 72, that reduces it down so that those rooms that would have 2 individuals in them would only have 1. So that way everyone can have a single room without having a roommate right next to them.
What does that do? What does that do to the census?
What that does to the census is it reduces it by 24. So 26, I'm sorry, get my math here.
And what, realizing that, but then do we have a waiting list? Does this create a waiting list, or have you been able to maintain it because of the COVID and you decided to keep it because of safety reasons and you don't have the need for the beds?
The slide from earlier, I did show the slide that does show the wait list numbers. If you want to refer back to slide, I don't know, Scott, do you have it there to pull it up? There were a total of 56 days last year that we did have a wait list on that program. And then if you look at the slide of number of patients by month, you can see the number of patients by month on that slide. It's slide number 12. And so we were asked to submit budget reductions. And so we had reduced to that 72. And so things that recognizing it could create delays and it could be harder to move people through the system. But that was one of the things that we had been doing, and so we did submit that as a reduction to continue with that.
Is this just particularly because just of COVID, and then you plan to go back to that, or is this a permanent change?
I think that would depend on what's decided through the budget cycle. That was one of the reduction packages that was submitted. Currently, the way it stands today, it's a change because of COVID. If that is picked up and that permanent reduction would be approved, then it would be a permanent reduction.
Have you had any fallout on that? Because I think there's a lot, the community and other people have been a little concerned about not having access to those beds. So that's, I'm asking, is it permanent? Because most of us know we have to allow, for COVID. But what do we do when you need voluntary beds, or the sheriff's office needs beds, or the police have to have one while there's a mental problem going on? How do you plan to make sure we can still make those beds available?
Yeah, the way we would manage that is we would do as what we have done is we would maintain a list. If we get to a certain number, we would stop taking voluntary admissions, and then we would maintain that wait list.
And that in itself a little bit concerned for me, because then that says, well, we'll start doing voluntary risk. Well, we've been through that since 2015 with Osawatomie, not having voluntary beds available. And right now we're still on target to open Osawatomie for voluntary basis in July. Now, whether we realize that because of COVID, I do not know. But has there been much discussion about how do we handle this situation for community, and especially, and I'll use the sheriff's office because ours has complained about that as well. Where do we put these people?
Sure, Representative Ballard, it's Scott Brenner with KDAD. Maybe I'll help Lisa a little bit. I mean, you're exactly right. The reduction at Larned to 72, it's the budget would reflect that based on the governor's recommendation. If once we're clear of COVID or past whatever we need to do to maintain the bed count for safe isolation of patients, we could go back up to 90. It's not certainly intended to be a permanent reduction if we've got the funding to open the beds back up to 90. I will say from the agency perspective, if the governor's budget stays as it is, and that's what we're approved going forward, and we get past COVID and can safely use those the full 90 beds, I mean, that'll be a high priority for us to figure out what we can shift internally or find resources to use those beds, because we exactly know the circumstance that you mentioned that jails, sheriffs, mental health centers are facing as they're trying to find placement for folks. So that's in the planning, but we were required in the budget process to submit items for reduced resources that were achievable and actionable, and since this was something that we were had in place for COVID, it made some sense to keep that as a budget item, because for the foreseeable future, our capacity is going to be 72 for the health reasons. But we certainly target that for restoration as soon as we possibly can.
Mr. Chair, may I ask a clarification?
Yeah.
Okay. Well, the only thing I would think with that is this more a budgetary issue or a COVID issue?
The reduction package was a budgetary issue.
Thank you.
The dropping the census to 72 was because of COVID, because we needed to have places to isolate patients so they wouldn't spread the virus amongst themselves as they knew people were admitted or on the treatment unit. So the reason to go to 72 was because of COVID. It's also reflected in the budget, as Superintendent Dittman said.
Thank you very much. Thank you, Mr. Chairman.
Well, let me just jump in here, because I'm not going to be very as nice as you are. This is absolutely ridiculous. Absolutely ridiculous. I've been on a Zoom call with 9 sheriffs in western Kansas the other day. These folks, and the hospital association also, when you don't have those people and they're not admitted, who takes care of those? The hospitals, the sheriffs. Your average wait time here, 17 hours. So that's a sheriff's officer, that's someplace in a hospital, that's somewhere that those people have to go. That is no excuse whatsoever. Yes, COVID is an issue. COVID is getting over with. This is for 22, so this goes through next July. Don't try to tell us that this is a COVID issue. The other thing is you're closing a 20 or 30 bed hospital also. So why can't you put those people over there?
Mr. Chairman, as the superintendent said, we've got 3 distinct populations that live on the Larned campus, and we can't mix them. We need isolation space or quarantine space for each of them because of the potential of COVID. So they had to have separate spaces, and that using that 130-bed unit on the forensic side was the space that we had available at the time. I mean, the rationale is the same. That's not meant to be a permanent reduction. We submitted it through the budget because it was in place. But if we clinically didn't need that space for isolation and quarantine, I think I'm safe in saying we'd reopen those 30 beds as well.
Well, I'm going to cool off a little bit here and let Representative Helmer take over as with a question. But Scott, this is absolutely unacceptable. You guys are just shifting the cost of this, the 200 and some $1,000, you're just shifting it off to local governments and hospitals and all that kind of stuff, and it's just unacceptable. And so when we do the right thing here in this budget committee, which is fund that, we're going to look like the big spenders, but the governor, in fact, is the one that cut this budget. Let's make no mistake about what we're doing here and why we're doing it. Representative Helmer.
Thank you, Mr. Chair. I'm going to agree with what's been said previously and probably not ask questions so much as make a statement. We have things that are going to be happening in the future, and mental health is what we've all been working on, all been worried about. And to be cutting mental health, it's just ludicrous to me that we're putting mental health people out and putting them out for COVID. There are a lot of buildings around that, I mean, we need some big problem solvers around here to do something. We can't be putting mental health people out and giving them, and just like Chairman said, I've worked in this industry for so long, I know it's just going to go right down the road and be the problem of the highway patrol and you know, the homeless. They're going to be homeless, they're going to die, it's going to be everything else. So no, I'm not satisfied with this. We have to come up with another solution. Thank you, Mr. Chairman.
Representative Concanon.
Thank you, Mr. Chair. So I'm going to shift gears a little bit and ask, I've got a couple of questions. The ligature-resistant furniture was denied, but you never mentioned it again, the need for that again. And I'm curious about that. Why? I'll just let you respond to that.
I'm sorry, is the question, why didn't I mention it again?
I mean, yeah, I mean, is it not a priority? You requested it and it was denied?
Yeah, it was not in the governor's recommendations.
Okay, yeah, but neither was the video equipment, but you came back and spoke about that again. I'll just tell you what my concern is. We saw this at Osawatomie, and we delayed to the point where then we decertified. And I just want to make sure that we're taking care of our facilities. And if we need ligature-free furniture, then I think we should be getting it. Do you have any response?
I can refer as far as the ligature-resistant furniture. The request that we had submitted was for 40 of the 250 beds on the Isaac Gray building to have the ligature-resistant furniture. Speaking to the surveillance equipment, I believe that the governor recommended that in the 2022 budget, and that's why I want to mention that again.
I see. Okay. So the ligature-free furniture, is it replacing ligature-free furniture or is it replacing out-of-date furniture?
That request was to install ligature-resistant where there is not ligature-resistant. The 250 beds on that building do not have ligature-resistant furniture.
Okay. And then I'm trying to follow the trail of the money with the Department of Corrections. So, so I'll just tell you real quickly what I heard, that there are inmates that need mental health care, so they were sent to Larned, and then Larned was full, and so they were sent back to corrections. So when did the money go from Department of Corrections to Larned for it to go then back from Larned to Department of Corrections?
Yeah, I think for that question, I think I'm going to refer over to our CFO because she is on the line. Stacy, could you answer the question regarding the budget?
Yes, when those individuals with the original MOU was set in place, Larned State Hospital received that money to house those 90 individuals. As Larned State Hospital has gotten full and our SPTP population has increased, we've had more need for our beds and our staffing here. So I think there was like 30 sent back starting in 2016, and I think the last of the 90 all beds were sent back in 2018, I believe was the year. Since then, we had been paying DOC for every individual that was sent back and not housed here on our campus, $40 per day for 365 days a year. When we sent all of those inmates back and didn't no longer house any of the 90, we went ahead and we are interfunding that SGF money from Larned State Hospital's budget annually to DOCs because we are no longer housing those inmates. So this is kind of a wash when it comes to money. That's why it's not as part of our reduction package. It was in our supplemental request because we're just going to go ahead and say, you know, we give you this money, you get it every year, you just go ahead and have it in your budget to start out with.
Okay, thank you for that clarification. And then one last little question. Are you guys, are you using electronic medical records yet?
We have a homegrown electronic medical record that it could be better.
How old is it?
Oh, I don't remember. We've had it probably for at least 15, 20 years or more. I'm not sure the date.
Okay, thank you.
Representative Kincannon, it's Scott Bruner with KDADS. We are in the process, we're probably within 2 or 3 weeks of releasing the RFP for the replacement electronic health record system that would go on all four state hospital campuses that was in the approved budget last year.
Great, thank you.
Let me be clear here on what I said earlier too, for the staff and for you folks that are on here from Larned. This is not about you. You guys do a great job out there and we appreciate everything that you do. This is a budget issue strictly between us and the agencies. And so don't think for a minute that we don't appreciate everything that you do. This is more of a budget issue fight that we're going to be into here. So please accept my apologies if they're needed. But we will continue this battle on for your staff and for our folks, the sheriffs and the hospitals and all of those folks that are housing these folks because they can't get in your facility. So just remember that. Thank you. Committee, further questions? Let me ask you this. How many people, well, we don't have very many people traveling. I wonder, would it be possible to put off our hearing on Osawatomie until tomorrow? And we'll just pile it in what we don't get to. And normally, again, we would have people here that traveled and all kinds of stuff like that. And I think that it's not as imperative. There's a lot of people on Zoom, but I see Amy and I don't mind inconveniencing her whatsoever. So just a joke. But anyway, Scott, how would that work for your guys, your folks?
Superintendent feedback, would tomorrow at 3:30 work for you?
Let me look here. Yes.
That'll be fine, Mr. Chairman. We'll follow your lead.
Well, we would be here, if we did Osawatomie, we'd be here till 6:30 tonight, and I don't want to sit here by myself. So, anyway, committee, any further questions or anything like that? Representative Vaughn.
Thank you, Mr. Chair. I do have a clarifying question. Why were 18 beds chosen for that particular reduction? Is that just based on your average positive COVID cases, or why has that particular number been chosen for reduction?
It was based on the number of beds on the building that had double occupancy. So each of the units had a certain number of rooms that had 2 beds in them.
Okay, I'm just sorry. I'm thinking, so so it's kind of arbitrary in terms of you're just turning the double beds into single beds versus, you know, I'm just trying to think through if it's needed for quarantine. I understand that if you have residents who are testing positive for COVID and they need to be by themselves, that totally makes sense. But then otherwise, what would be the need to reduce a double bedroom to a single bedroom?
There are 6 rooms on each of the 3 units that have 2, they occupy with 2 people. And so if you fill both of those beds, then you have 2 people that are in close proximity to each other. With COVID, you don't know if someone's positive sometimes until they test positive. So you could have someone that comes in that is potentially positive with someone that's not positive, and there would be that spread of the virus between those 2 people without knowingly doing that. Where if you have a single room, then that is your room. Kind of going to the motel if you have a room with 1 bed, or you go with a friend and you both share the same room. Does that make sense? So that's where that 18 comes from, is six of those rooms on each unit. We didn't close the room, but we went down to having 1 person in that room instead of 2 people in that room.
Okay, that answers my question. Thank you.
You're welcome.
Just another, to bring things home, we have slide 12. And so look at the numbers of patients, 16 people on the wait list to get in. Those people are being housed wherever. The number of days on the wait list that occurred, 10 days had wait lists. I mean, this is totally unacceptable for us as a state to even allow this kind of stuff. So stay tuned, folks. Any other questions? Representative Helmer.
I want to clarify, did you say that the electronic medical record system was recommended and okayed last year and you're working on it? Did I understand that?
That's correct, Representative. We've got, the money was appropriated in this fiscal year 21.
So we don't have to worry about that.
No, not in terms of appropriations. We've got to stay on the timeline to get the contract awarded and signed and then start implementation, but the funding's not an issue. And the governor's budget, you'll see this in the KDAD's budget. The governor's budget includes some ongoing operational costs for the new system in 2022. So you will see that in the KDAD's budget when that comes up next week.
Any further questions? We're adjourned.